Diabetes mellitus in cats is a chronic disease that affects carbohydrate metabolism due to either an insufficient insulin response or insulin resistance. Like diabetes in humans, it is characterized by chronically high blood glucose. Diabetes strikes 1 in 400 cats, though recent veterinary studies note that it has become increasingly common. Symptoms in cats are similar to those in humans. Diabetes in cats occurs more frequently than in dogs. 80 to 95% of diabetic cats experience something similar to type 2 diabetes, but are generally severely insulin-dependent by the time symptoms are diagnosed. The condition is treatable, and treated properly, the cat can experience a normal life expectancy. In type 2 cats, prompt effective treatment may lead to diabetic remission, in which the cat no longer needs injected insulin. Untreated, the condition leads to increasingly weak legs in cats, and eventually malnutrition, ketoacidosis and/or dehydration, and death. Symptoms: progression of untreated diabetes in cats is very similar to that in humans. Cats will generally show a gradual onset of the disease over a few weeks or months, and it may escape notice for even longer. The condition is rare in cats younger than 7 years old. The first outward symptoms are a sudden weight loss, accompanied by excessive drinking and urination. For example, cats can appear to develop an obsession with water and lurk around faucets or water bowls. Appetite is suddenly either ravenous or absent. These symptoms arise from the body being unable to use glucose as an energy source. In cats, the back legs may become weak and the gait may become stilted or wobbly. A fasting glucose blood test will normally be suggestive of diabetes at this point. The same home blood test monitors used in humans are used on cats, usually by obtaining blood from the ear edges or paw pads. As the disease progresses, ketone bodies will be present in the urine, which can be detected with the same urine strips as in humans. In the final stages, the cat starts wasting and the body will breaking down its own fat and muscle to survive. Lethargy or limpness, and acetone-smelling breath are acute symptoms of ketoacidosis and/or dehydration and is a medical emergency. Untreated, diabetes leads to coma and then death. Treatment: diabetes can be treated but is life-threatening if left alone. Early diagnosis and treatment by a qualified veterinarian can help in preventing nerve damage, and, in rare cases, lead to remission. Cats do best with long-lasting insulin and low-carbohydrate diets. Because diabetes is a disease of carbohydrate metabolism, a move to a primarily protein and fat diet reduces the occurrence of hyperglycemia. Diet is a critical component of treatment, and is in many cases effective on its own. For example, a recent mini-study showed that many diabetic cats stopped needing insulin after changing to a low-carbohydrate diet. The rationale is that a low-carbohydrate diet reduces the amount of insulin needed and keeps the variation in blood sugar low and easier to predict. Also, fats and proteins are metabolized slower than carbohydrates, reducing dangerous blood sugar peaks right after meals. Recent recommended diets are trending towards a low-carbohydrate diet for cats rather than the formerly recommended high-fiber diet. Carbohydrate levels are highest in dry cat foods made out of grains, so cats are better off with a canned diet that is protein and fat-focused. Both prescription canned foods made for diabetic cats and regular brand foods are effective. Owners should aim to supply no more than 10% of the daily energy requirement of cats with carbohydrates. Pills oral medications like glipizide that stimulate the pancreas, promoting insulin release, are less and less used in cats, and these drugs may be completely ineffective if the pancreas is not working. These drugs have also been shown in some studies to damage the pancreas further or to cause liver damage. Some owners are reluctant to switch from pills to insulin injections, but the fear is unjustified. The difference in cost and convenience is minor, and injections are more effective at treating the disease. Insulin injections Humans with type 1 diabetes are often treated with a basal plus bolus method, where a long-acting insulin is injected once or twice daily to provide a basal insulin level, then shorter-acting insulin is used just before mealtimes. For cats, A basal method is usually employed instead. A single slow-acting dose, twice daily, attempts to keep the blood sugar within a recommended range for the entire day. With this method, it is important for the cat to avoid large meals or high-carbohydrate food, since they can seriously affect the blood sugar. Meals may also be timed to coincide with peak insulin activity. Once-daily doses are not recommended, since insulin usually metabolizes faster in cats than in humans or dogs. For example, an insulin brand that lasts 24 hours in people may only be effective for about 12 in a cat. Cats may be treated with animal insulin, or with human synthetic insulin. The best choice of insulin brand and type varies from animal to animal and may require some trial and error. One of the popular human synthetic insulins, Humulin N/Novolin N/NPH, is reasonable for dogs, but is usually a poor choice for cats, since cats metabolize insulin about twice as fast. The Lent and ultra-Lent versions were therefore very popular for feline use until summer 2005, when Eli Lilly and Novo Nordisk both discontinued them. Until the early 1990s, the most recommended type for pets was bovine porcine-derived PZI, but the type was phased out over the 1990s and is now difficult to find in many countries. There are sources in the US and UK, and many vets are now starting to recommend them again for pets, but they have been discontinued by most manufacturers as of 2007 to 2008. A new synthetic PZI analog called ProZinc is now available. Caninsulin, made by Intervet, is a brand of porcine-based insulin, which is approved for dogs and cats, and is available both through veterinarians and pharmacies with a veterinarian's prescription, depending on the country. Vitulin was recalled in the USA in November 2009 due to inconsistent strength. According to the manufacturer's website, the insulin's action profile was long and flat in dogs, but in cats was similar to that of NPH insulin, and lowered blood sugar quickly, but for only about 6-8 hours. Vitulin is available again in the USA as of April 2013. Two new ultra-slow time-release synthetic human insulins became available in 2004 and 2005 for improving basal stability, generically known as insulin-detemia and insulin-glargine. Studies at the University of Queensland, Brisbane, Australia have had positive results with insulin-glargine in cats. Follow-up research Rump and Rand, Vet Intern Med 2008, 22-791 shows that Levemir can be used with a similar protocol and that either insulin, on this protocol, can lead uncomplicated feline cases to remission, with the most success being in cats who start on these protocols as soon as possible after diagnosis. Dosage and regulation. Timing. Cats may in some cases have their mealtimes strictly scheduled and planned to match with injection times, especially when on insulin with a pronounced peak action like caninsulin, Vitulin or Humulin N. In other cases where the pet free feeds and normally eats little bits all day or night, it may be best to use a very slow-acting insulin to keep a constant level of blood glucose. Some veterinarians still use the outdated recommendation of using Humulin N, or NPH insulin for cats, which is very fast-acting for most cats. The slower-acting Lent and ultra-Lent insulins are being discontinued, so most cats are now using either the veterinary PZI insulins, or the new full-day analogues Glargine and Detemir. Regulation. The goal at first is to regulate the cat's blood glucose, which may take a few weeks. This process is basically the same as in type 1 diabetic humans. The goal is to keep the blood glucose values in a comfortable range for the cat during the whole day, or most of it. The most successful documented method is tight regulation with Lantus or Levemir. Typical obstacles to regulation include, chronic overdose masked by Somoga. A dose that is too high can easily cause a Somoga rebound, which can look like a need for more insulin. This condition can continue for days or weeks, and it's very hard on the cat's metabolism. High carbohydrate cat food. Many commercial foods are very high in cereals and therefore carbohydrates. The extra carbohydrates will keep the cat's blood sugar high. In general, canned foods are lower in carbohydrates than dry ones, and canned kitten foods lower still. Recent studies show that cats' diabetes can be better regulated and even sometimes reversed with a low-carbohydrate diet. When switching foods, it should be done gradually. Cats on a special diet for pancreatitis, chronic renal failure, or any other condition have more complex needs that must be managed by a medical professional. Inappropriate insulin. Different brands and types of insulin have idiosyncratic effects on different cats. With some dosages, the insulin may not be lasting long enough for the cat, or may not be the best choice. Testing blood sugar more frequently can determine if the insulin is keeping blood sugar down throughout all hours of the day. Some cats may require a different type of insulin if their current one is not working. Blood sugar guidelines absolute numbers vary between pets, and with meter calibrations. Glucometers made for humans are generally accurate using feline blood except when reading lower ranges of blood glucose.